Most men think erectile dysfunction is just about getting older, being stressed, or feeling tired. It's easy to brush it off as something natural, something that just comes with age. But here's the truth. In many cases, ED is not simply a problem of aging. It is the very first warning sign that something far more serious may be happening inside your body. Think of it like a check engine light. When your car flashes that light, you don't ignore it. You take it to a mechanic. In the same way, ED is your body's way of signaling that your blood vessels, your hormones, your nerves, or even your prostate might be in trouble. And here's the critical part. Only a urologist has the specialized training and tools to uncover those hidden causes before it's too late. Ignoring the signal could cost you much more than your confidence. It could cost you your health and even your life. When most men hear the words erectile dysfunction, they think only about performance in the bedroom. But the truth is, ED is much more than that. It's not just a problem of function. It's a condition that's deeply connected to the health of your blood vessels, your nervous system, and your hormones. Let's break it down. One of the most common hidden causes of ED is heart disease. When arteries become narrowed or hardened, blood flow is restricted. And because the blood vessels in the penis are much smaller than those in the heart, ED often appears years before chest pain or a heart attack. Then there's diabetes. High blood sugar slowly damages both the blood vessels and the nerves that are necessary for a strong erection. Many men don't realize they have diabetes until ED forces them to get checked. Another factor is hormone imbalance, especially low testosterone. This doesn't just reduce sexual desire, it affects energy levels, sleep, mood, and even muscle strength. And finally, we cannot forget about the prostate. An enlarged prostate, inflammation, or even early signs of prostate cancer can interfere with sexual function. That's why doctors often say ED is not just about sex. It is often the first visible symptom of deeper hidden conditions. Recognizing it early could save not only your confidence, but also your health. Here's where things get critical. Many men visit a general doctor when they first experience ED, and while that's a good start, most general practitioners focus on the surface. Maybe they prescribe a pill. Maybe they suggest stress reduction. But what they don't usually do is dig deeper into the hidden causes. That's exactly where a urologist comes in. First, there are hormonal changes. Low testosterone is the most well-known, but it's not the only hormone involved. A urologist can test not only testosterone, but also prolactin, thyroid hormones, and other markers that can quietly sabotage sexual function. Without this specialized testing, imbalances often go unnoticed. Second, blood flow problems. ED is often caused by restricted circulation. A urologist can order a Doppler ultrasound of the penis to see whether blood is flowing normally or whether narrow or blocked vessels are cutting off supply. This kind of precise test isn't part of a routine physical. Third, nerve damage. For men with diabetes, Parkinson's disease, or a history of spinal injury, nerve health is critical. Subtle nerve damage may explain ED long before other neurological symptoms appear. A urologist knows how to detect and interpret these signals. Fourth, prostate abnormalities. Prostate enlargement, inflammation, or even early-stage prostate cancer can all contribute to ED. A careful prostate exam or PSA test performed by a urologist may reveal problems early when they're most treatable. Finally, medication side effects. Many common prescriptions, blood pressure drugs, antidepressants, heart medications list ED as a side effect. A urologist understands which drugs are most likely to cause issues and can work with you to adjust or replace them safely. And here's the key. These are not things a general doctor usually tests for. That's why so many men live with untreated ED while the real disease continues to grow in silence. Seeing a urologist could make the difference between simply coping with ED and uncovering a condition that might save your life. When a man first notices erectile dysfunction, the natural reaction is to visit a general doctor. And that's an important first step. A general practitioner can perform a basic exam, review your health history, and perhaps prescribe a common medication. But here's the limitation. Most general doctors stop at surface-level treatment. They often see ED as an isolated problem rather than a warning sign of deeper issues. A urologist, however, takes a very different approach. This is a physician who specializes in men's health, specifically the urinary tract, the prostate, hormones, and the blood vessels and nerves that make sexual function possible. That means they have the expertise to ask the right questions, run the right tests, and connect the dots between ED and larger health risks. And when it comes to treatment, a urologist doesn't rely on a one-size-fits-all solution. Instead, they create a personalized care plan that might involve targeted medication, hormone therapy to restore testosterone balance, lifestyle adjustments such as diet, exercise, and stress management, or even advanced procedures and surgery if needed. Each plan is designed not only to restore sexual function, but also to protect long-term health. That's why experts emphasize a urologist doesn't just give you a pill, they find the root cause and fix it. For men over 50, that difference can mean moving from temporary relief to lasting results, and from silent risk to real protection. One of the greatest advantages of seeing a urologist early is the chance to catch problems before they become life-threatening. Erectile dysfunction is often the first visible clue, and if you take it seriously, it can literally save your life. First, you can protect your heart, because ED often shows up years before chest pain or a heart attack. Early testing may reveal cardiovascular disease when it's still manageable. That gives you the chance to make changes and prevent a serious event. Second, you can prevent diabetes complications. Many men discover their blood sugar is dangerously high only after developing ED. With the right guidance, a urologist can help manage blood sugar and prevent the nerve and blood vessel damage that makes ED worse. Third, you can balance your hormones. Low testosterone doesn't just affect sex, it robs you of energy, disrupts sleep, and even impacts mood. Correcting hormone imbalances can help you feel stronger, younger, and more vibrant. Fourth, it's about prostate health. A simple exam may detect enlargement or even cancer at a stage when treatment is far more effective. And finally, it's about quality of life. When you address ED with the help of a specialist, you gain more than just confidence and intimacy. You gain the peace of mind that comes from knowing your body is healthy and your future is secure. Men, if you're over 50 and experiencing erectile dysfunction, this is your wake-up call. Don't ignore it, don't try to hide it, and don't waste precious time chasing quick fixes online that only mask the problem. ED is not just about performance. It's your body talking. It's a signal that something deeper may be wrong, and the sooner you listen, the better your chances of protecting your health. A urologist is the one who knows how to listen to that signal. They have the tools, the knowledge, and the experience to uncover the root cause, whether it's your heart, your blood sugar, your hormones, or your prostate. And once they find it, they can help you not just treat the symptom, but protect your health, your confidence, and your future. So take action today. Make the appointment. Get tested. Get answers. Because protecting your health and your future is worth far more than pretending nothing's wrong.